Hello, everybody, and welcome. The room is so packed. I'm so happy to see everybody here in the room. And before we start, we have exciting stuff to show you today. I'd like to ask the room, who is today a Doctolib user? OK, so looks like most of the room. In fact, there are 90 million patients in France, in Germany, in Italy, and in the Netherlands that are using Doctolib. And we are collaborating with 400,000 health professionals. And yes, we will be talking about AI and GenAI, and most importantly, about primary care. So when I joined Doctolib 10 years ago, at the beginning, we had two missions. And even today, we still have the two same missions. And the first one, for health professionals, it's about improving their daily lives. And for you, maybe, for patients, for the people, for the general population, what we're trying to do is to make sure they can be healthier. And how so? So for health professionals, they have mainly three areas where we can help them. The first one is about making sure they provide the best care possible for their patient. And then what we want to do is to make sure that every day when they come at work and care for their patients, they have a great work-life balance. They have a better working life. And lastly, we want them to make a better living. For you, maybe for patients, people, of course, we've been always about access to care. You can book online, you know already. But now we are going even further because we want to help patients receive a better care from health professionals because they will be helped by our solutions to do so. And also, we want them to be taking care of their health or the health of their relatives by themselves. So we were there last year to present the vision of Doctolib on AI, and what a year it has been. And the teams, together with health professionals and with thousands of patients, we have been trying to crack what can we do with AI to help accelerate on the two missions of Doctolib. And I will show you after, but 1 month ago, we launched our first fully AI-native product. And we call it the consultation assistant. But also, the teams are working on a virtual phone assistant, on a patient data coding tool, on a financial assistant, prevention assistant, medical assistant. You can see them all here. But what you can just remember from this presentation is that all the areas that are doing today health professionals in their day-to-day lives can be revolutionized by AI. If we take the example of the virtual phone assistant, today, most people are either booking online or calling the practice. And when we call the practice, we are disrupting the workflow of the secretaries or even the workflows of health professionals. Thanks to a virtual phone assistant, you will be able tomorrow to book online or by telephone, discussing with an AI agent in a seamless way. And thanks to that, we'll give back time to health professionals and secretaries to do more patient welcoming, clinical stuff. And I think time in a practice is so important. Relieving from administrative burden, from mental load, will be done thanks to AI. If we take another example, let's take the prevention assistant. So the best way to do prevention is to mix patient health data and medical knowledge so that we can have tailored prevention at scale. And we believe we can do that. And we are trying to do that right now. And so we want to give health professionals the tools to suggest to patients the correct preventive actions and to suggest them with proven data sources, and mostly thanks to our AI models. So on current existing products of Doctolib, we are trying to enhance them with AI, but we are also trying to launch new products based or fully AI native. And the first one, I told you, it's our consultation assistant. Launched 1 month ago, and already, like the feedback we got from health professionals, it's something we have never seen before. The last big launch that we had was Doctolib itself 10 years ago. So let's watch a quick 1-minute video to see what it's all about. So as you can see here, we are looking at the side of Doctolib for health professionals. And when you are in a consultation with a patient, you start our consultation assistant. You do not have to take notes anymore. Everything is recorded. And then at the end of the consultation, as you can see, we have a full synthesis, but not only a synthesis on diagnostic, treatments, or family antecedents, or whatever. It's well dispatched in the correct places of the patient record. And if during the consultation you say, I'm weighing, I don't know, 80 kilograms, in the weight part of the patient record, there will be 8 kilograms, because we are trying to extract the right data and put it in the correct field. And so during a 15-minute consultation, the amount of time the health professional, the doctor, is spending taking notes is close to 0. At the end, obviously, they screen everything, validate, and make sure it's perfect, but we have a higher recall rate. So the notes are more exhaustive. We have, so the documentation in the end is way better. We have doctors telling us it's crazy how good now the patient records are completed. They don't have to spend their time typing on their keyboards. They can look patients right in the eye. And we have comments from patients, so maybe some of you already, but for sure in the future you will see that for yourself in the practice, telling us I've never seen such a contact with an health professional, because now it looks like a one-on-one conversation, and it's crazy the proximities that we can recreate thanks to AI. And we believe AI is meant to give back humanity in the way we humans speak and interact into each other. Lastly, it's all about like the little things, changing your posture from typing like this and trying to talk to the patient to be like front-end facing. We have feedback from doctors telling that now they don't have a backache anymore. And it's all the little details like that that at the end of the day are telling us it's crazy that what you do on the consultation assistant. But we'll go even further. Today, health professionals, they are kind of data scientists. They are typing a lot of data, but it's difficult to have easy, quick, codified data. And I think we can do it. We can also put less pressure on medical secretariat, like I told you with the virtual secretariat assistants. And lastly, you are searching a lot on Doctolib. We have several 100,000 million searches every month, and we think we can help you find the correct health professionals thanks to a search improved with AI. So I've cited nearly 10 use cases where we are trying to move forward on AI, but it's important to say that we cannot do it unless it's done in the right way. And the responsibility that we have is really, really high. So the first, it's all about humanity. We are doing AI at Doctolib for the benefits of human, of proximity between health professionals and patients, and that's our main goal. Then, on precision and transparency, we don't have the right to do mistakes. And in the way we do our products, we always check how accurate they are, and we want to go to the zero error as close as we can on the topics. And if we are not sure, we will disclaim that. Also, we have so strict standards on privacy and data security at Doctolib since the first day, and it's even more important today. And lastly, we want to stay in France and in Europe to do it today. So we believe it's really only the beginning of AI. We can't wait to be there again in 1 year to show the progress on the 10 AI products that I show you. I'd like to thank you very much for your attention, and I hope that tomorrow, when you will be using Doctolib AI products, you will see the impact that we do on healthcare professionals and on yourself. Thank you very much.